Hey, what the vet fam? Welcome to another episode with us. Tonight's we are talking about zoonotic disease. And for the people that watch it that aren't veterinary related, zoonotic is what pets can give to us and we can give to pets. Slight disclaimer, you are going to see facial expressions out of me that are out of context. I have a TENS unit on and it is contracting some muscles that it needs to contract and it is painful. So I come with a warning label because it goes in waves and different steps and sometimes muscles contract and it's really fun. And at one point you're going to hear me
looks like short-circuiting.
Short-circuiting, focal seizures, take your pick. And then I get really hot. So you might hear me just randomly go on hot. And then also Allie Dog likes to put her head when I have the TENS unit on it. So it adds pressure on an already slightly painful scenario. So if that happens, noises may come out. So just again, fair warning, because she knows it's on. She saw me put it on and she gets excited. Because for some reason she likes it as well. She likes the vibration. But lane change, back. Zoonotic diseases. As a vet tech, we definitely come into contact with something along those lines several times a year. Would you say? At least? Depending. It doesn't matter if you're GP or specialty. It honestly doesn't matter. And I've personally come into contact with what we thought was a rabies case and having to deal with that. And the owner and practice manager not wanting to pay for us, the two techs that were exposed, didn't want to pay for us to get the rounds of rabies because it was going to be out of pocket, which at the time was around $800 and she didn't want to pay for it. And animal control dropped the ball on telling us if it was a rabies suspect or not, because you had a 6-week window. We found out on week 10 or 12, which would have been too far gone should it had been rabies. Thankfully, it was not, but it had all the classic signs of a dog that was getting into the end stages of rabies. Had the fear factor of water, drooling, convulsive, like chomping, like the whole 9 yards. It was actually like, it was a very long overnight shift that was slightly terrifying. And then, yeah.
It was fantastic of them to not want to pay for you to have post-exposure, vaccines rather than have the scrubs suit off of them. That's fantastic.
Yeah. And for people that don't know, in order to test for rabies, you have to euthanize the patient, even if, like, it's by law, if you suspect a pet that has rabies, they have to be euthanized and their head is sent off to be tested because they have to take the brain, turn into slices, look under a microscope. It's not just a blood test. It's not just, sending certain samples off while you wait. That's the only way you can test for rabies is brain matter, pretty much, under a microscope.
And
we haven't gotten that far.
Yeah, a lot of times too, they have to be quarantined for 10 days prior to euthanasia, unless they're behaviorally not sound, they're not doing well, or some kind of serious health issue presents itself. Then you have to get permission from the health department to be able to euthanize and then have their brain sent off for testing.
Yep. We're exposed to leptospirosis is probably one of the other most common ones, excuse me. And the pets can get that from drinking dirty water out in any puddle that wildlife may have peed in it. That's the most common. There are vaccines for it, but there's not really. And if anybody watches this and they know the correct answer, because I don't at the moment, I'm drawing a blank, is if there's a human lepto. I know there's a pet lepto, but is there a human lepto?
I don't
know what I've been vaccinated for.
No. I think it's all strictly on the animal side, which is zoonotic to us. I don't think that there's a reverse transmission factor or risk.
Yeah.
I think, there's multiple strands of lepto, but I believe it all originates on the animal side and transmits over to humans.
Yeah. And that one I would say is iffy on if they will treat if you come in contact, because it depends on how you've come in contact with the pet, with their blood and urine.
Yeah.
Because
Go ahead. Yeah.
No, that's pretty much it.
No. So it's like if there's a risk for exposure, say necessarily a risk for exposure, but if you're dealing with a patient that's come back, lepto positive, and you've had contact, with urine, things like that, it's imperative that your workplace sends you to somewhere, whether it's, a GP or an urgent care, to get you started on antibiotics prophylactically. Because by the time you start exhibiting symptoms, that shit's already set up shop in your system and is already starting to do damage. So it's better than to prophylactically start on the antibiotic therapy, which is doxycycline, bro, and it sucks. I've had to do it multiple times because of lepto exposures. But it's better to do that than deal with the ramifications afterwards. Because, I mean, if you think about it, this could technically be a workers' comp situation. So you as an employer as well need to get off your ass and make sure that your staff is getting taken care of if there's a potential exposure. Because it's pretty
And I
serious.
just want to point out, Amber said that she has been treated prophylactically. Don't ask me to say that name normally. I have to say it very specifically, and even then the stutter comes out multiple times. Ask me how many times I have.
How many? Well, maybe
And I
because you're more careful than me.
mainly worked emergency and specialty care. Treating lepto patients is our jam a little bit, or, diagnosing them is a little bit of the jam in internal medicine. No.
Yeah. Well, and I think with the leptospirosis cases too, it depends highly on, where you're at in terms of your risk of exposure. So, mainly your dogs and your livestock. So the area where I lived and where I was, working for GP and for shelter med was a highly rural area. I mean, it used to be. Now it's like I don't want to get into it, but it used to be a very rural area with a lot of livestock, with a lot of cattle production and things like that. And that increased our risk factor. And especially the fact too, that back in those days, like it's like 1883 or something. But back in those days, leptospirosis vaccines were not recognized as a core vaccine. A lot of people were afraid to vaccinate against it because of the impurities in the vaccine causing so many vaccine reactions. People were afraid of it. Practitioners were afraid of it. Even still to this day, some of them are.
Yeah.
So again, your areas where you are in terms of exposure. That was and they're still to this day getting reports of exposure in that area. So good job.
And the one thing, and this is a case where I said no blatantly from the start, that I didn't want to be involved in.
Mm-hmm.
And the place that I had worked at, it was in Florida, way before our time, Amber. The vet did a lot of pro bono work for the wildlife and exotic pets and rescues in the area. She was known for that. And we knew for several days at least ahead of time that a chimpanzee was going to be coming in. And we're not talking a baby chimp, we're talking like a 45-year-old chimpanzee coming in.
That's a
And I said from the get-go, I will not mess with this animal. And it's not because it's a chimpanzee, it is because they are too close to the human line, right? Like, no touchy touchy.
No touchy because they got grossness.
They got grossness. They like to throw feces and semen. It was a male chimpanzee, so he was even like, it was a no for me. Yeah, they like to throw their own semen at people. They're gross.
That's disturbing.
Don't ask me how I know all this. It's not the point of the conversation.
Oh, now I'm curious. Now you got me curious. Because I've heard about monkey shit fights at the zoo, but not like semen slams. You know what I'm saying? Like,
no, because they like jerk off and then they chuck it because it's gross.
You just chuck it in the fucking bucket at that point, I guess. God, I didn't know that.
Yes. So chimpanzee was coming. He was coming with his own vet that was wildlife based. And again, I said no. But the problem with me at the time, I was the only one in the building that knew how to run the CT machine. And they wanted a CT done on it because they were searching for the cancer, pretty much. They were doing the cancer search. But instead of doing CT first, they did blood work, they did ultrasound, they did all of the things. And it took hours and hours of making this chimpanzee get Tilazol and ketamine injectably that he was getting very used to by the time it came to my turn of CT machine, because he wasn't under full anesthesia. We had an oxygen mask on his face and then just drugs periodically, right? And you think, oh, CT machine, real quick. And this wasn't the one that we were used to. This was an actual animal-based CT machine. So it was very click happy. Like, I told anybody that wanted to learn it, like, I will teach you today. They all said no, which is rude, because what happened was I did the CT, came out great, gave contrast, came out great. All the vets were looking at the machine and looking at the little window, looking at all the slices and that. Chimpanzee wakes up. Guess who's holding the oxygen mask pinned against a wall?
Oh,
This one.
God. Nope. Nope. It'd have been a street fight right there. I'd have been on Oprah too. Like, I ain't even playing.
No joke. He ripped the oxygen mask and hose out of my hand. My hands went up in the surrender position. I'm like, help, help.
He's gonna eat my face.
I literally, that's what I thought. I was like, this is how I die. Attacked by a half drugged chimpanzee because he was coming up looking at me because I'm stranger danger to him. He don't know me. Luckily, his handler was also in the room, came running over. He gripped onto her. I ran like a fat kid getting hit by a dodgeball.
Or getting
Gone.
chased with a handful of monkey semen.
And I said, y'all on your own. I'm out because this is why I didn't want to be involved in a chimpanzee case. Don't do monkeys. But
No.
again, no didn't mean no.
No.
No one, everyone said, you're doing it. And I said, and the only choice that I had was to either keep my job or walk out. And needed my job.
Yeah.
And it ended
Damn.
up, the chimpanzee did have cancer. He had multiple
Oh,
myeloma, which was found on the CT machine because of his bone.
poor
Bone
baby.
was getting brittle. He was thinking of chomping my face off.
He was just a baby. He was scared. He was
He
dysphoric.
was
He was
45.
Yeah, but when you're high and 45, you still get dysphoric, you know? And he's still just a baby. Just a baby. I would have cuddled him and he'd have ate my face. Ugh, yeah. That's
Terrified.
scary because, like you said, they're so close to us in disease processes and things like that.
Yeah.
Like, it's like transmittable thing. It's scary. I love
I
monkeys,
didn't
dude.
even
I
want to
love
mess with
primates.
like the little Caputin monkeys that would come in. I
Nope.
didn't even want to mess with them. They're
Nope.
even worse.
Yep, they're worse. They're nasty little fuckers. But yeah, no, I
They
love
are
primates,
dirty.
but I like to look at them if they're in the
Like,
wild on videos, and I will never be a
that's it.
primate technician.
Absolutely not.
No.
Like, one of the vets that, and it's been mentioned throughout that, they're like, what great apes are you terrified? Is it the silverback? And then they're like,
Yeah.
honestly, no, like silverbacks, they're aggressive. Yes. It's the orangutans that are
Yeah.
terrifying because they want to study you. And by studying you, they want to open you up and like pick apart and do all the things.
Yeah.
They're too smart.
They're like little serial killers, bro.
Pretty
You
much.
know?
Pretty much. You think
Yeah.
they're so cute because they're all snuggled up, but really they're studying you.
Yeah. They're ready to pick your whole life up. But yeah, no, that's scary to think about the communicable things that they have. But
Mm-hmm.
yeah, it's our field is gross. Humans are gross, but our field is gross too. We get so many weird, nasty things, and you think about the routes of transmission being
Yeah.
fecal oral.
Well, and like lepto, urine.
Yeah.
So like, and that's the joke is don't lick the pee.
Yeah, don't like
Like, oh,
that's
they're like,
part.
what do I do? I just touched this dog that might have lepto. Well, did you lick its pee? Did you drink
Right.
the pee? Well, no. And
Did you
I'm like,
stuff your
okay, then
fingers in your
odds
mouth?
are,
You pick
I'm
your
like, odds
nose,
are you're okay.
Yeah. Yeah.
This is why I'm a big advocate, and it was after my start in internal medicine, is to always wear gloves. Doesn't matter if you're in GP or not. And I know
Yep.
it's still a taboo thing. Protect that's your first line. That is your first defense is these mitts.
Yep. 100%. And when you
Here.
have these mitts that are contaminated, you want to put your fingers in your mouth and all up in your nose and all over your phone,
And it's
like
so
you're just
easy because
spreading
you,
shit
you
everywhere.
touch one thing and you touch another thing and then you're just touching
Yeah.
everything and then you touch your face and you got to
Yeah.
cut somewhere and
Yeah.
now you truly exposed yourself to lepto versus
Yeah.
you've got gloves on, you touch that pet, well that pet pees right then and there and it's technically
Yeah.
on you but it's on the glove.
Yeah. And too, like not
That's
just
my rant.
lepto, we're exposed to all kind of crazy shit. Ringworm,
Tick-borne diseases, which isn't
tick-borne
technically is
diseases,
I don't even know if that
toxoplasmosis.
falls on zoonotic tick-borne
You
because
already
it doesn't.
come
I mean, it
directly
comes
from
from.
the animal. Yeah, it doesn't come
Yeah,
directly from a patient, like, or directly from an animal to us.
no, it's a
Um,
tick, but we both get the disease.
yeah, it's from a bug, so it's not really. I don't know if it would be classified as zoonotic. That might be something we'll have to look up. But there's so many
Yeah.
different things that we are exposed to every day, and sometimes we don't even know. And a lot
Mm-hmm.
of them are very serious, very life-threatening diseases that we could be, or viruses and stuff like that we could be exposed to that could be career enders, life enders in some instances. I
Yeah.
mean, have you ever had a patient, like you said, you were talking about a patient that were potentially exposed to rabies
Mm-hmm.
and how those things work. So you were talking about the patient needing to be tested for it, and the fact that we can't test them while they're alive, there's no blood tests and stuff like that. And when you're waiting for these quarantine periods or even these testings to be completed,
You're terrified.
you are. I will
You're
attest to that
terrified.
100%, because I
I
had a
was
patient.
terrified the whole time,
Yeah,
me and that tech, because it was, I mean, if you saw a video
yeah,
of a rabid dog at the same stage that this dog was at,
yeah,
same
yeah,
symptoms. And you were like, I was, and drool flinging all over. Yeah, we didn't even have, like, and at the time it came in and it just throughout the night got progressively worse. And then the drool
yeah,
started flinging and it was on our face.
yeah, yeah,
We didn't have the shields.
yeah,
Yeah, we had as much PPE as an emergency clinic that was open nights and weekends had, but like
yeah.
not to deal with a rabies case.
Yeah. And like, should our number one differential when we get a neurologic patient come in, vaccinated or not necessarily may say differential, but concern be rabies? Absolutely. Should we PPE? Should we wear personal protective equipment? We should. But do we? I got a case of the fucks today. Do we? 9 times out of 10, no, because we're in autopilot and we just go through the motions, And even too, if you're dealing with a patient that come in that's sick, and like for instance, the case that I had where where I thought I had rabies exposure, and I literally, like, for those 10 days I wanted to die. I
Mhm.
was so like anxious and like, oh my God, I got to get this in order. I got to do this. I got to tell my grandma I love her. I got to tell my mom. You know what I mean? Like, I was
Yeah,
freaking out because it was an error
there's
in
no cure.
judgment. Yeah, made by a relief doctor that put myself and another person at risk. And to protect the other person, she was like 16 or 17 at the time. She didn't have a lot of experience, but to protect the other person, I took the bite. I got her out of the way when the cat started flipping out. I grabbed the cat and I took the bite. That cat bit the shit out of me. So there's no question in my mind, had that animal come back positive for rabies or shown signs in quarantine, that I was done. So he
Hmm.
presented for seizures. He was hyperthermic at 107.1. Vaccination status unknown. Feral outdoor cat. A recipe for
Yeah.
rabies, bro. I was dying. I go to the emergency room. Human medicine does not deal with this on a regular basis. And they were arguing
No,
with me, saying that I needed blood tests before they could give me a rabies vaccine. Now, a charge nurse was arguing with me that I needed to have blood tests before they could give me a rabies vaccine. I had to school her on how to actually test an animal for rabies, and the fact that they could not test my blood. It was a whole ordeal, but finally I got my post-exposure vaccines, And then somebody let a bat from a rabies positive area in the county loose in my fucking office. Oh my God, look, I found this bat. Bitch was gone. You want to talk about needing a new pair of scrubs after that? That was scary. But the shit we get exposed to, and like you said, lepto. I've been on doxycycline 2 or 3 times because of exposure to lepto in a practice. You
yeah.
know what I mean? And practice managers, practice owners, doctors, things like that. Guys, lepto's serious. So if your
Hmm.
staff are exposed to it and they've had direct contact with these patients, oh, they were wearing gloves, they were okay. But if they're not wearing the proper PPE, I got it that time, then they need to be taken care of appropriately, because you don't know what shit that they're touching, like what's happening. Like, send them to at least get a report on file, get them started
Yeah.
prophylactically on antibiotics. That way, should they become symptomatic, become positive, that is something that they're covered for under workers' comp, and you started the case appropriately and on time. Just
Because
saying.
also, Tex, you now have a lawsuit that you could easily win.
Yep. Yep.
Easy.
Yep. And two, like, not, and we're talking about lepto, we're talking about rabies, right? So these are the more prevalent things that we have to be
Hmm.
concerned about. But does anybody ever talk about exposure to giardia, right? Does anybody ever talk about or think about, exposure to toxoplasmosis? Have you ever seen that in any of your coworkers, any of the practices that you've worked in?
Ironically, I've seen a human doctor get giardia.
Yeah, my cousin got it. Yeah. But it
It's
wasn't
a
from,
thing.
yeah, it wasn't from veterinary medicine. It was
I was gonna
from
say,
like
I was like,
trip abroad.
and he got it from being outside,
Yeah.
right?
Yeah.
He get it from an actual patient, maybe one tech.
Yeah.
That's like in the very like first or second year of being a vet tech.
Yeah. And like, my ex got toxoplasmosis from her cat.
Yeah.
And it was weird because we knew what happened to the cat. We knew he was positive. He was being, managed, this, that, and the other. And she gets up one morning and starts walking into shit. I was like, are you drunk or what the fuck? What is happening? It's 7:30 in the morning. And she's looking at me like, I don't know. And is like veering off to the side, ataxic and like has vertigo, whatever. And I'm like, what the fuck? And I'm like, oh my God, no, your cat. She's like, what do you mean? I'm like, your cat has toxo, bro. Oh, I
Yeah.
don't have that. Sure as shit, she came up positive for toxoplasmosis.
I've gotten ringworm in my armpit from holding like a kitten like that. Like how
Ew.
you normally do. Like right
Yeah.
there. That was a 10
That's
out of 10. Don't. Oh,
that's
it
itchy.
was, oh, it
You
was
just walk
so
around
bad.
looking like your chimpanzee patient.
Literally, it was so bad. So like I've gotten ringworm there. And it was a 10 out of 10 the worst. And like
Man.
we didn't realize like and the kitten was in early stages, like you had to really like spread the hair to get that spot,
Yeah. Oi.
you know,
That's
to see.
crazy.
Yeah.
Yeah.
Sorry.
And
That was a
two,
big one.
like, you got your ringworm, you got your taxa. Like, we're going through things, and then you have things like MRSA that people don't think about. I've had patients come
MRSA
back
is
with
everywhere. MRSA is
everywhere.
everywhere. You
Yes.
could go outside and touch the cleanest object and it's going to come back with MRSA.
Exactly. But like that's why I stress the importance so bad of cleanliness in a veterinary hospital.
Yes,
But
100.
clinic
Oh, yeah.
hygiene, you need to wipe everything like your x-ray table, everything down. Like you need to make sure it's disinfected because you and I've seen it in practice. I've had
Yeah.
patients come up test positive for it, and it's I don't want to say preventable because we can take as many steps as we want to prevent it and obviously things happen, but like clean up after yourselves in the hospital, dude, because your patients are going to get it, your staff is going to get it. No pun intended with the staff issue, but
Hmm.
it's something that we don't think about that we should.
And this goes out to Amber Squared, who taught us all about the cleaning products.
Mhm.
Listen to those people that do that because
Mhm.
you can't just spray and wipe it down. To Amber Squared,
No.
it's on my head now. Every time
Mhm.
you have to let it sit
Yep.
and percolate because that's what's going to kill it.
Yep. And I always question, bro, what's the concentration of that rescue?
Yeah.
Because you have, when your concentration, your different ratios, your different contact times, things like that. Guys, listen, when you're just spraying down a killing, you're wiping it out. You're not preventing any kind of disease. You're buffing the steel. You need to
Yeah.
let that stuff sit, have the appropriate contact time to kill what it needs to kill, especially like those enveloped viruses and things like that are very, very hard to penetrate through those cell walls or whatever it is to destroy them. Like you need to be cleaning appropriately your x-ray table, especially your lab counters, anywhere you're preparing your samples when you're doing your ear cytologies and stuff like that. You got to clean that appropriately. And yes, I'm glad you brought up
Yeah.
Amber Squared. Rescue Virox interviewed her ass at VMX. They interviewed her. And let me tell you something, Amber, I love you. And I'm still pissed that they didn't give you a shirt. Hashtag Virox should have gave Amber a shirt. I'm going to start it. I'm just saying that. There's nobody on this planet
Get
except
Amber
for,
shirt.
who developed fucking Rescue knows more about that product and how to use it than she does.
I
But
mean,
anyway,
facts.
I digress.
We digress on that because, and also Jackie, if you're watching, you were top tier on making sure everything was clean
Yep.
and things were actually separated that need to be separate. Bleach,
Yep.
bleach, honey. We knew things were actually clean when she was on shift.
Yep. Because your lungs hurt and your eyes were burning and your nostrils were bleeding. Like it's clean. I can't breathe, but it's clean.
You just
Yeah.
knew everything was appropriately being
Yeah.
sanitized.
Yeah, absolutely. And two, like I'm glad you say that because there's a differences between disinfection and sanitizing, and we as veterinary
Yes,
professionals, medical professionals, should know those differences to prevent the
correct.
spread of diseases and things like that. And I mean, I could talk about this shit all night, but clean your hospitals, guys. Make sure that you're reconstituting or making the appropriate concentrations of your disinfectants or they're not going to work. When you're not cleaning appropriately and you're not mixing these things appropriately, you're not protecting yourself, your family, or your patients. So get your shit together. Stop being nonchalant about cleaning out cages and buffing that steel. Clean it, disinfect it, sanitize it, and especially your surgery suites.
And wear
I'm done.
gloves.
And wear gloves. Wear gloves. But we need to be more cognizant as a field of the things that we are exposed to. Because there are times I know when some of us fall ill, whether it be an exposure or non-exposure related situation, we end up, in the hospital or the doctor's office or something like that. we've got to be able to communicate what it is that we do and the things that we are exposed to our medical professionals so they can essentially weed through things. Like when I worked at the shelter, I had this conversation with my staff and then with the kennel staff. And one of our kennel staff guys, love him to death, I think I scared the shit out of him, to be completely honest with you. Goal achieved. He went and had metal plates, like metal cards, made for all of us that stated everything we were exposed to, for all of us to carry on us at all times. Road officers, kennel staff, everybody carried that with them at all times. I thought that was a phenomenal idea. Absolutely great. Because if something were to happen, here, rule these out before you start going looking for zebras.
Yeah.
So, yeah. Know what you're being put at risk for, and do your best to prevent it, you know?
Because I mean, again, it's something that we can get from our patients.
Mm-hmm.
From something that is treatable to something that could potentially kill you.
Yep.
You know, and
yep.
we get into this field because people are gross and we don't like people, but we still have to be careful on what's coming in through the doors. You know, I know we get kind of in and out, X, Y, and Z, same thing every day, blah, blah, blah. But it's the ones that come through the door that you think are just the run of the mill. And that's what ends up getting you, honestly.
Yeah, and they have the worst shit. The most bright alerts responsive patient comes in there and you're like, oh my God, Fluffy was kissing all over my face and he's got some nasty shit. You know what I mean? Just some nasty shit. And so do his owners now.
It just hasn't kicked in yet. Yeah.
So do you. But yeah, take that extra time to disinfect properly. Know your diseases, like, you know, just be smart about stuff. And as a manager, I want to encourage other managers or clinical managers, whatever it is that you do, to have standard operating procedures in place for exposure. A how-to manual if you have a staff member exposed to A, B, C, or D, what you do from there in order of severity, your rabies, and then on down. Just so everybody's on the same page, everybody knows what needs to be done, and you can maintain, you know, safety protocol, things like that throughout. Just get your standard operating procedures in place. That's my soapbox.
I agree. I said I agree because honestly, I've never worked at a place that's had it.
Well, every place should. And if you can't figure it out on your own, you're sitting down, you're drawing a blank, and you can't write your SOP, y'all, ChatGPT can help you immensely. It can give you the idea for a foundation, and you can roll right with it all the way through. Yeah. So it saves you time. But just make sure you have that so you know how to deal with those things and stop being so nonchalant because you haven't seen it that it doesn't happen. Because it does. It happens every day.
Every day.
Mm-hmm. Yeah. And I've been exposed to some pretty nasty shit, excuse my language, dealing with shelter med, with animals that have been in homes, with deceased, decomposing owners that they have fed off of that I've had to clean. Yes, I wore PPE. Yes, it was disgusting. Yes, they had pieces of tissue in their fur coats. But again, who thinks you're going to encounter that in veterinary medicine? So your shelter med any technician, just be aware of the things that you could be exposed to. That's all I ask.
Yeah. So on that, we're going to leave you with that image, and we'll see you guys next week.
Make good choices.